apologize for the audio. Dr. Acton is again still in front of the display of the curves, the steep curves, which shows no intervention and a rapid escalation of the virus being spread. Something they saw in Italy, something the health officials here in the United States and here in the state of Ohio are trying to avoid. Dr. Amy Acton is now back at the podium.
We do have a compass. We know what we do is perfectly imperfect. And I know it is so hard at a time like this with a flood of media to tolerate ambiguity. There is going to be ambiguity, but I've already seen incredible genius. And when we talk about what our hospitals are doing, I think you'll be very impressed. A lot of you are hearing about personal protective equipment and the moves we're taking, asking for the limitation of unnecessary or perhaps elective surgeries is essential. The truth is, and you've known this, and you'll be hearing more about it in days to come, there's a limited supply of this. This is the N95 mask you're hearing so much about, and I'll let folks come up and take a look. This is the one that has to be fitted to healthcare professionals. There's different sizing. It's important because we're getting that perfect seal. We have a great shortage of these. You're hearing about a national stockpile. We have some, but the numbers are nowhere near what we
She's holding up
we're hearing from the front lines.
Medical mask to protect coughing germs from spreading.
While they don't protect the spread of, for the healthcare professional, they are useful in putting on a patient who is suspected so that they don't cough the respiratory droplets onto people. These shortages are real. We are going to see new things in healthcare, new innovations. But the fact is, we are going to be preserving this, and we're going to be making calls and asks and potentially orders come Monday to help us take the ones that are out there in circulation, perhaps in an ambulatory setting, perhaps for elective surgery, and redirect them so they can be used by our healthcare institutions. We've got to take the healthcare situation very, very seriously. Look at Italy. They do have a good healthcare system. This will tax any modern healthcare system, what we have ahead. I want to talk about the 6 feet also. The numbers are coming up, and we're talking about 3 to 6 feet of separation for folks going. But I thought today on the way here about 6 degrees of separation, the Kevin Bacon rule. So Kevin Bacon is going to be used here. But the fact is, what we're doing, these measures seem so drastic, and when you're healthy, again, I drove home last night and was eerily quiet on the streets, and you're thinking, I'm healthy, what does it matter what I'm doing? It is about Kevin Bacon's grandmother. It is about those 6 degrees of separation we all have to each other, and this exponential spread. Every time we go out and about and infect 2.28 more people, as the latest stats show, that those are going out and doing the same as logarithmic. That curve goes up, and we put that stress on the healthcare system. So we've got to think about this in a different way. I know we're not socialized to think this way, but it really does matter what we each do. So I think I'd like to turn it over to Dr. Thomas.
Good afternoon. Andy Thomas. I'm Chief Clinical Officer for the OSU Wexner Medical Center. I've been asked to make a couple of comments about steps that hospitals and physicians and providers in general have been taking over the past week related to the COVID-19 outbreak. I think many of you have seen in both the local and regional sense a number of facilities have put forward swabbing stations, the ability to increase with the access to testing now in the state of Ohio, the ability for patients to become swabbed, essentially to have specimens collected to be tested, are being set up at the local and regional level across the state. Obviously, hospitals and physicians are gearing up for taking care of these patients, whether it's someone who needs to be in the ICU or someone who just needs to be seen in the emergency department, swabbed, and go home. It's an important aspect, as you've heard, about the capacity of the system to make sure that we are doing all of our part to make sure that we're preserving that capacity for the future. Many of our hospitals across the state have begun in this past week instituting visitor restrictions. So I would highly recommend, if you are planning to go visit someone in the hospital, to check that hospital's website to make sure there aren't restrictions either around age, around the number of visitors in any given day or any given time. to make sure that you're not going to make a trip then that you won't be able to get in and see someone at the hospital. Many hospitals have also implemented screening of visitors at entrances just to make sure that someone who has a high-risk exposure, either from travel or exposure to an individual, or certainly someone who has current symptoms, is not coming into the hospital setting and bringing that virus potentially into where there may be people ill with other things. And last, certainly but not least, as you've heard about the potential concern for PPE, as Dr. Acton has shown you, the hospital medical advisory group of physicians and hospital leaders across the state has been meeting over the past week, and one of the issues we've been talking about is developing criteria for how we limit the performance of elective surgical cases and other types of medical procedures. That really has a threefold benefit to the system at this point. First, it's a little bit difficult in many hospital waiting rooms to practice social distancing. Having fewer people at the hospital makes that easier to do. Certainly, if we can postpone a procedure or postpone a surgery for weeks or longer, and that's not of danger to the patient, it might be the right thing to do just from the social distancing alone in terms of people being near each other. Secondly, as the governor mentioned, if that patient needs to be in the hospital after their procedure, when we can safely postpone it, that will preserve that hospital bed capacity for patients with COVID-19. And third, it preserves these very important pieces of our inventory, because this is what our staff, this is what our patients and their families need to be protected when someone is in the healthcare setting. So the hospitals across the state, under the guidance of the Ohio Hospital Association, are coming together to develop criteria about when something can be safely postponed. Obviously, we would never want to put a patient's health at risk trying to solve one problem by creating another. However, there are elective procedures that if they were delayed a period of weeks would not be any danger to the patient. We want to make sure we do this smartly, taking into account the specific nature of different specialties and certainly the way different facilities practice. So I think across the board, the governor's mentioned dentists, it's mentioned veterinarians. There are obviously a lot of ambulatory surgery facilities in the communities, ambulatory endoscopy suites, and hospitals where we all need to be taking this approach together to make sure that we're preserving our capacity. Thank you.
That was Dr. Andrew Thomas from the Ohio State University Wexner Medical Center.
Dr. Thomas was saying, these drive-through capabilities, you're hearing about them. A lot of this is strategic so that we don't bring people in the emergency room. However, it's not a drive-up like McDonald's. You must be screened. There still is limited testing. We're